So, there's honestly been some pretty disheartening news recently, and you may be aware of all the recent gun shootings that have been going on in the US lately. You know, the elementary school shooting in Texas, in New York, the supermarket shooting. And just recently, a couple days ago, we had a shooting at a hospital where two physicians were killed, as well as, I believe, a patient and somebody working at the front desk. And for me, as somebody, I'm a resident doctor, I'm going into my last year of training. It's just a really tough piece of news to hear because it feels like there's nothing safe anymore. Nothing is sacred. You know, even places of healing, going to the hospital where you're trying to get better, you're trying to get treatment. And then we as doctors, nurses, and other health professionals are trying to help people. Like, you're not even safe in these locations anymore. And so I just wanted to give my quick, initial thoughts and reactions to this recent event. And also just talk about, what are the kind of the implications of this going forward? Is this just going to become like a normal thing going on, like in the future? Is this something we're going to have to be worried about every time we go to the hospital and work every time? What does this mean for providing care to patients? Are we always going to have to be afraid that if a patient becomes angry, they're just going to go out and buy a gun and just come back and start shooting? What if we don't give somebody opioids because we feel like the risks of it are going to be bigger than the benefits they may get from it, and they become angry? This situation happens all the time. Now it's like almost like a life or death thing. So the implications of this is huge. And I feel like, there have been shootings at hospitals before, but now if this becomes more of a common occurrence, this is going to be something that's at the back of your mind at all times, which is just really unfortunate. So here's some quick news coverage of the shooting in Tulsa, Oklahoma.
Police have identified the gunman as Michael Lewis. They say they found a note in his pocket after he killed himself that indicated he was upset about the pain that he was still in 2 weeks after having surgery.
This is something that a lot of people were bringing up on Reddit. This person just had a major back surgery and was having pain 2 weeks afterwards. That is entirely expected for a back surgery. So many times patients expect to go from 10 out of 10 pain to 0 out of 10 pain right away. But especially right after a surgery, it's going to take you months for the pain from the surgery to go away. And so this person had very unrealistic expectations to think they were going to be completely out of pain in 2 weeks. And the fact that they were able to go and buy a gun and then walk into the hospital and then start shooting people with an assault rifle. Basically, I mean, if that's not the best possible recovery that you can think of after a major surgery, that's better than 90% of patients who have just gotten a spine surgery.
Dr. Preston Phillips was apparently his surgeon, and Lewis apparently blamed him for the pain that he was still suffering and not doing more to ease that pain. Police say that Lewis bought one of his two guns last month, or it's actually a few days ago, and the other just yesterday, hours before the shooting. They say he also killed the receptionist, another doctor, and a patient who was in an exam room.
Yeah, I'm just looking at this hospital here, and it's just eerie for anybody who works in the healthcare system, because this could be anybody's hospital, anywhere. This could be your hospital that you're working at right now. I wonder how the people here at this hospital are feeling going into work, the few days after this. Are people still feeling safe going to work? The chances that you're going to get shot by somebody are exceedingly low, but for it to actually happen in the actual workplace that you're at, it's just a horrible thing to think about. So here's on r/medicine, 2 physicians killed in Tulsa shooting. Dr. Phillips was a brilliant surgeon and just an all-around nice guy. I picked him to be my surgeon and waited months for him for my L3 to S1 fusion because I knew him to have an excellent bedside manner, having taken care of some of his post-ops. This hurts. Ease of gun access is the 5th vital sign. Unbelievable that he bought it the same day, but gun laws won't prevent this. Yeah, I go on some other subreddits too where it leans a little bit more conservative, and anytime there's a shooting, people are like, oh, well, gun laws wouldn't have prevented that. That gun was, obtained on the black market. But this is a prime example of how ease of access to guns leads to situations like this. And you can argue, the majority of them, they are from the black market. I don't know the statistics on that. But even then, if we can prevent any amount of like senseless lives lost, there's so many valuable lives that were just lost. It's 4 people. It's not one of the biggest shootings ever, but think about how much value those 4 people were bringing to that community over there. And now they're just gone in a few seconds. Dr. Hewson was an alumnus of my medical school. Amanda dated a longtime family friend for a period of time. My dad worked many cases with Dr. Phillips. The point is that it can happen to you. It can happen to people you know and people you love in your community for no rational reason at all. Just awful. Here's a bit of a timeline. May 19th, went for the back surgery, discharged 5 days later, bought a gun 5 days after that, got initial treatment on the 31st, and then the very next day went and got an AR-15 rifle and then started shooting his doctors. This is the point that I wanted to make. I guess the thing that blows my mind, this guy wasn't 6 months post-op with a raging bone infection and nonstop pain and burned through a ton of different therapies. Insanity knows no logic, but seriously, that is a short timeline to get so murderously angry. Being able and willing to do this 13 days post-op tells me his healing was going fairly well. Guy was able to walk into the clinic with a rifle less than 2 weeks after back surgery. That's better than most of my patients are doing post-op day 14. But in all seriousness, this is terrifying. I went on to R/residency after that, and I felt like they had a lot of really salient points as well. A lot of them talking about the length of time we spend sacrificing in our 20s to do all this training. And, it's a huge sacrifice, and we do it because we want to help patients. And yet the public actually really doesn't like doctors and actually has a lot of disdain for doctors a lot of times. And, all of it can be lost in a second if something like this happens. Your entire life can be gone. Apparently on r/news, which is one of the big subreddits on Reddit, they were kind of even blaming the doctor. They were saying, there's bad doctors out there too. Like maybe this doctor deserved it. And for me, that's just so crazy that that's like the public opinion of doctors. Like, some of these doctors are so bad, they deserve to be shot and killed. Like we glorify these businessmen who go up and like scam people or maybe do shady business deals, make billions of dollars. They're glorified in American culture, whereas doctors are like vilified. They're thought to be corrupt and like trying to take advantage of patients. In reality, it's completely the opposite. People go to medical school, they sacrifice their entire 20s. They basically don't become a well-rounded person because they have to spend all their time studying. And we try to do it because we want to provide patients with the best care possible. And it's a very hard field. It's very stressful. We do very long residency and get paid basically less than minimum wage for most of our training. We're in hundreds of thousands of dollars of debt. And yet this is kind of how the public perceives us, that it's like okay to shoot doctors. So again, it's just a very dehumanizing and disheartening outlook for, medical professionals such as ourselves. You spend your youth training and studying nonstop, putting aside relationships to spend more time honing your skills so you can better help people you've never met. All that sacrifice so some nut job with a gun can take it and end it all in a second for nothing. Dude, I used to be pro Second Amendment, but the more time I spend in medicine and with people, the less I think we should have access to firearms. I totally agree with that because there are so many people who are like off the hinge that people really, it needs to be very, very careful who you decide that is appropriate to have firearms. I was generally okay with it most of my life, but as an intern, I was on call during one of the mass shootings a few years ago, and seeing people walk in the front door of the ER, blood trailing behind them, was enough for me. Absolutely over it. And this just happened to me. I was on overnight when the Sacramento shooting happened and 7 people died and dozens of others got shot as well. And so many of those patients ended up coming to our ER that night. And we were there. It's just like blocks away where that happened. I remember when there was another post about mass shootings in the past, and they were talking about banning assault-style weapons. ER doctors were talking about how with simple handgun wounds, a lot of times they can fix the damage, but when it's an assault rifle, the way that it like tears apart the inside of a person and just kind of eviscerates everything, it's completely on a different scale than just a normal handgun. And so even just a sensible limiting of assault style weapons really is a public health issue, right? Because these ER doctors have to go in and these trauma doctors have to go in and deal with this, and they can't repair stuff if it's a massive kind of damage like from an assault rifle. So, a lot of times doctors, people will say, doctors shouldn't be getting involved in politics and, stay in your lane. This is not, part of your thing to be worried about, right? And people say that for all other sorts of people too, like celebrities, basketball players, everything like that. But for this issue in particular, it really is a public health issue. People are dying and they become patients that we have to deal with. And this is 100% a public health issue, especially now that people are coming and bringing guns to the hospital and shooting up healthcare professionals. ER resident here, we just had a patient steal a guard's gun in our ED, shoot and kill the guard, and then kill himself. This is the most obvious and frustrating counterpoint to the good guys with guns argument. In the vast majority of cases, adding guns to a bad situation just makes it worse. How the F do we have hospital shootings? Once young school children were killed in mass shootings, nothing is safe. I just feel so hopeless about these situations now. You aren't safe at work, can't feel safe at school, can't go to groceries, or can't go to the movies. What kind of freedom do you really have? The American kind, the freedom to die. And this is totally true. For me, over the past few months, I didn't really have this before, But even just biking to work, I've honestly been afraid because we had that recent shooting in Sacramento. I've always just been afraid when there's like people walking the streets. I'm like, oh my gosh, I'm afraid that like people could just randomly take out a gun. There's like such random violence nowadays. You can never tell when somebody's going to try and do something crazy. I am a South Korean medical student, and whenever I see these kind of mass shooting incidents in the States, it is so surprising. In the US, even people with mental problems can buy ARs so easily. Within a week, I've seen 3 mass shooting incident news in the US, and there were hundreds of mass shooting incidents in the past couple of years, but nothing has changed. I know gun lobby in the States is extremely strong, and I have no right to interfere to the US society, but US citizens should do something for real. I am very much thankful that I don't have to worry about dying all of a sudden because of gun shooting. I can pretty much walk everywhere at any time in South Korea without any concern of danger. I feel thankful for that, and I feel like this should be the same for people in the US as well. Imagine going through a decade and a half of rigorous, brutal studying to become a spine surgeon just to be slaughtered in your own job. 1 physician shot in Orange County 2 weeks ago, 2 physicians shot and killed yesterday in Oklahoma. We can't even feel safe in a place meant for healing. Just had a patient's family tell me he would have shot the doctor too if he wasn't given more pain meds. I was just dumbstruck. My wife rounded on an ortho patient who twice threatened to shoot the attending if he needed another knee revision. I feel like we need to start reporting this stuff to the police and inform the patient of this. This is the kind of person where there would be reasonable cause to confiscate all their firearms / suspend license, put on a registry, in my opinion. This is another piece of news that just came out today now. Doctor and 2 nurses stabbed at Encino Hospital Medical Center near Los Angeles. Bruh, WTF is going on? And then this is a video from Doc Schmidt, and he made this before this hospital shooting even happened. This was after the elementary school shooting, and it's basically talking about if doctors used gun activist logic, and this is basically the video here.
We've been losing so many of our patients to cancer. A report just came out that shows that we're losing more patients every day to cancer than we ever have before. We need to start using chemotherapy to try to treat the cancers. Shame on you for using a national tragedy to further your own agenda. But chemotherapy is very effective for many cancers. Even if we use chemotherapy, the cancer will just find another way to kill you. It'll become resistant. This isn't really a cancer problem. It's a kidney failure problem and a respiratory failure problem. We just need to be doing more dialysis and intubations. Other countries use chemotherapy all the time to treat cancer, and their rates of cancer death are way lower than ours. Plenty of people have cancer and they do fine. It's a part of life. We've got to try something. I had a patient with metastatic colon cancer who died from it perforating her intestines. Chemotherapy wouldn't have made a difference then. Cancer is caused by environmental exposures and diet. We should focus on fixing those, not forcing chemotherapy on people. You don't think it's worth trying? I think this could really make a difference. No, cancer doesn't affect me personally, and prescribing chemotherapy would be a pain.
And it's funny, but it's also so true. It's like, you know, the biggest thing with gun activists is like, they don't even want us to try anything, right? And we have like evidence proven things for treating cancer. And that would be like saying, you know, we shouldn't do anything for any cancer. Like just because something's a problem means you should try to do something to fix it. You shouldn't just not do anything to fix it, right? You're just gonna let it happen and fester and just not do anything. So I think that was a really well done video by him, and he got a lot of criticism, I think, from that video, and he ended up putting another post later. But I think majority of people can see the logic that he puts out and that they agree with that. I think there's just a few people who really would disagree with that, but it's just such a good way to like kind of show the ridiculousness of this kind of logic. So anyways, that was just me going over a little bit of the recent news and the recent tragedies that have been going on lately. And honestly, I don't have much of a point other than to say that guns are a public health issue, and I think it's going to start affecting more and more people. And it's crazy that it's affecting our profession and hospitals, elementary schools, grocery stores, everywhere. Like nowhere is safe. And it's a scary thing to think about, to be honest. It's going to affect the way you work and the way you live your life. You know, being exposed to this kind of news all the time really is not good for your mental health, and it just becomes this kind of negative trail where you just go in this negative spiral all the time and just hear about all these horrific things that are happening all the time. And so on the one hand, I feel like I should just stop following this kind of news and just, you know, kind of turn a blind eye to it, not pay attention to it. But then that's almost kind of like the emu or whatever the animal is that like sticks their head in the sand when they're trying to be afraid of something. You know, you're just like willingly allowing yourself to be blindfully ignorant. And this is something that people need to open their eyes to, and we need to start addressing more as a profession and as a country, and just as humans in general. This is definitely something that we need to figure out a solution to. I hope that in my time, you know, on this planet, that we find some kind of solution to this, because it sucks to have to live in a country where This kind of thing is just commonplace now. So what are your thoughts on this news, and what do you think are some things that we could do to prevent this from happening in the future? Do you think that we should be taking more steps to have better gun control in the United States? And maybe you totally disagree with me. So I'm curious to hear what your thoughts are. And thanks for watching. I hope you found this video interesting. I'll see you in the next one, and peace.